All right.
2023, 6 p.m., 6:09 p.m. And call to order the Town of Northborough Board of Health meeting for the evening. We're going to hear a lot of updates this evening.
Updates to keep you all informed, nothing urgent or critical that we're voting at this point. So I just want to give you a general update on the Greater Boroughs Partnership for Health. We submitted our draft budget for the Public Health Excellence Grant. So again, just a reminder that we did receive additional funds this year in excess of the original $300,000 award. And so that additional money, we have moved our epidemiologist position over to that grant because that grant is sustainable and could last for 3 additional renewable terms of 3 years each, so an additional 9 years. So if you remember, our epidemiologist was originally hired under a contact tracing grant, which was just a 2-year grant that extended for that 3rd year. So we've submitted that budget and we're excited about it. Not really tons of supplies, more about staffing, but we have some flexibility. So it's about maintaining Michael's position, the epidemiologist, and there's some wiggle room left in that grant. So as salaries increase, you know, cost of living adjustment, merit increases, that grant still has a little buffer room to be able to fully fund those positions as they're currently. So we're excited that was submitted. We haven't heard anything back, but everything looks good there. And Isabella's doing a great job in keeping up and supporting me with the annual reporting requirements and attendance at the meetings. And that Greater Boroughs Partnership for Health is meeting this Wednesday. We do have a meeting coming up, so we'll be talking about some of the special projects. So that also relates to, under that same Greater Boroughs Partnership for Health, we have the contact tracing grant, which was extended for a 3rd year. We anticipate, I just finished the budget, which is due on Thursday. We're rolling over. We did have an additional $100,000 in that grant that we're not going to expend this fiscal year. We originally had a full-time health nurse, but then when they reduced all the contact tracing hours, we didn't need that additional body at that time. So we had a part-time nurse that ended up transitioning for other reasons, personal reasons with Sam and VNA. So we just didn't refill it. And so we do have a surplus there and some supply. We had buffered some additional per diem nursing that we didn't need. You know, at the time when we set the budget for fiscal year 23, there were a lot of unknowns. So we will be rolling $100,000 in addition to the $160,000 on that grant. So at Greater Boroughs Partnership for Health, the public meeting tomorrow, which is on Zoom, we'll be talking about some special projects. So we've had some preliminary approvals through the state funding agency. We're going to be purchasing AED CPR training equipment for the nurses. So we have all that equipment in-house that was approved. It's around $10,000, and purchasing 12 dummies and AEDs and all the training supplies that would go along with it, so we can continue to offer the lower reduced cost CPR courses. We're hoping, you know, $20 or so. Keeping it low, which has been done through Be Well. And we're also we're really excited about possibly doing a community health improvement plan, working with a third-party vendor to review the Metro West community health assessment that's going on now. I think you all received that email to do that 10-minute survey. We've had a good response in Northborough, so that was circulated through the superintendent. So rather than us do our own community health assessment, they're most like Metro West Health Foundation will share that data, and that was done in Northborough and Southborough and Westborough because we're within the region. So we're hoping that they also have a robust response, and then we'd be looking to take that data, work with a third-party vendor who's experienced in community health assessments or community health improvement plans. Typical vendors could be like an HRIA, John Snow Institute. There's a few other smaller groups that have done it. Worcester just did it with JSI. There's another group called Moxley. So there's several vendors. We'd likely go out to bid or an RFP process. Have that vendor work on doing some additional focus groups to maybe fill any gaps in understanding community needs in different demographic areas that maybe weren't hit with the survey results, and then to help our region come up with a community health improvement plan. So where do we want to focus our efforts? So given that we have this funding available and it's really, the funding is, really just this 1 year. We can't roll it another year. So we have that large rolling $100,000. Those community health improvement plans can cost upwards of that. A town of our size would probably never have the ability to do a community health improvement plan. So that's where we're focusing our efforts, as well as we are in discussions with Salmon VNA. They have a maternal child health program where they still do home visits for moms that are discharged earlier. Maybe there's some complications and follow-up, either with the baby or the mother. And so they do have nurses that are trained and skilled in that area. They even are referred through Dana-Farber Children's Hospital, so for any patients in this region. So there is a new baby program through the state. There's a funding source. It's only really done in the big towns like the Boston, Cambridge, New Bedford. There were some other big towns. But we're looking to model that program with some of the contact tracing funds that would be available and try to offer some new mom resources with like a voluntary reach out and additional visit if new families are interested.
So because we do refer through Salmon, but it goes through their own private insurance, so who's paying for what you're talking about?
So a lot of the times people do qualify through their insurance. What we're finding is a lot of residents are not aware. Families aren't aware that they can get that home visit. In this case, if we were to do it with the grant, we would just do it that it would be paid through with the contact tracing grant for those visits. Because a lot of times by the time we get to that family, it might be, they may have timed out from their insurance eligibility. If they can't get the visit in the first 3 weeks, they may no longer be eligible. So we're hoping by running the program through the contact tracing grant and through that program, and we're working with the state on that approval process, we can hopefully capture some moms that may have missed that window to be covered by insurance. So part of it's just that health education to let them know that that resource is available, but that's where a skilled nurse would enter the home, would check, vital signs on the child, weigh the baby, maybe talk about breastfeeding or any other wound care complications. But it would be done under Salmon VNA's orders, so they would be going through their liability insurance because they do provide that service.
And when does this start?
Well, we're in development right now. It would be in fiscal year 24, and we'd have to go through like greater boroughs with approval. But the goal would be to launch that program, sometime in the fall.
Okay. And how will you let it be known to the residents, or is it you'll communicate it to the offices, the clinics?
So our goal would be to work through local pediatricians' offices to make just like our home wellness flyer we've offered for seniors. So going through the hospitals, discharged to so many towns, I think it might get lost in the shuffle. It's not like we have one sending hospital that, So we'd be working through local pediatricians' offices, working through with our staff is actually setting up for Greater Borough some social media accounts to have a little bit more of a presence there. And then our goal is to work with the town clerk who gets all the birth certificates, some hospitals much faster, and that the nurses would send a new baby welcome letter to the address on file. So it would be a nice letter from the health department letting them know this program exists and additional resources, and they could call to schedule a visit if they'd like it. So that's some of our ideas we're kicking around. It's great.
Good.
Nice, yeah. Hopefully.
Yeah.
Let us know
That's
more
good.
as
Yeah. And so we'll, the goal too, if we were to really get the program off the ground and develop those resources, I think we could sustain it through that other state grant, once we built up the program. So this would give us sort of a fast track way to do it in those skilled nurses that would be ready. So there is a reimbursement program if we were to go through the approval process and the steps with the state. So after this, one last year of grant funding available there, we could hopefully sustain it if it seems to be worthwhile based off feedback. So that's our Greater Boroughs update.
Great. Tell us about the municipal opioid settlement funds.
So if you were at town meeting, we talked about this a little bit. At town meeting, the town voted to approve the appropriation of the settlement fund. So to date, I think in fiscal year 23, the town received $107,000 in funds with very specific use, and will continue to receive those settlement funds for the next 16 years.
Oh.
So there's really that upfront larger payment in the first year or two. There was many settlements, right? And so really when you lump it all together, we're gonna average, if all the settlements go through as suggested with the tables, will be, the town of Northborough alone will be receiving around $55,000 in opioid settlement funds for the next 16 years. So it's a substantial amount of money to think about programming. So we, the town, through the town administrator's office, is scheduling interdepartmental meetings to continue to discuss this. A lot of the suggestions from the state, there is very, detailed document on what towns are allowed to do with the funding. And so we're talking with various town departments, youth and family services, police, fire, schools. One of the things our nurses have been helping with is to just research some curriculum to improve our health curriculum, or offerings to purchase like a pre-purchase program. So they're looking at various curriculum out there and working with the schools to evaluate that and to see if we could pilot in the middle school starting this year. There's discussions, curriculum that would include substance use prevention. In that they do have a health teacher there, so that would, there's a body, but they've sort of had a homegrown curriculum to the state. So can we help to improve that? Other things we're looking to do, and we'll have a draft for you. I'd like to see the Board of Health if you have comments. One of my goals would be do a postcard in July when those funds are available, to residents, to every household, to let them know about our Narcan, sort of the harm prevention strategies. So the free Narcan program and training for families, letting them know what our fentanyl test strips and what are the other harm reduction, as well as highlighting some of the state's resources on substance use prevention, behavioral hotline, all of those other numbers. And we're working with MIS-GIS on a input form. So similar to ARPA, there is a requirement to solicit input from the public about how we're using those funds, or how, what the town may do with them. And I think, I don't have the language in front of me, but it's specific to those that have been directly impacted by substance use, either recovery or a family member. And so we're hoping to use that town-wide mailer postcard as a way to educate the public that the town has received these funds, here are some existing resources, and that we'll be working to develop sort of those next steps and what other things we may do with the funds. So it's not enough to necessarily hire a whole body at $55,000 if you rethink benefits and all the rest, but either a part-time position or supplementing it with other funds. And by July or August, we'll know if the town's to receive the drug-free community grant, which could complement this type of work as well. So more coming. So I want to open it up, and I can circulate to all of you the allowed uses document following this meeting. And if you have ideas or know of anyone you think might be helpful to the town's approach. So ultimately the use of the funds will be approved by the town administrator's office through the Board of Selectmen. So that's really, it's not through this board, but we'd be able to provide input, ideas, suggestions, and then ultimately that's the board and office it would go through for use.
Should look into addiction counselors. It's tough to come by.
Okay, that's a good thought.
There's a part-time one for the boroughs.
So, and I know Westboro, the town, I talked to their health director, I believe they're speaking with Spectrum to provide some of those services to expand, but it's really addiction counselors.
Yeah, addiction counselors.
Yeah.
Right now there are a couple in Worcester, but for families who live here, it's crowded. Yeah.
I know there is a program through, I believe it's the DA's office, or is funding with recovery coaches, and I want to say it was with Family Continuity, maybe out of the Northbridge area, but anyway, same thing. I know our police chief is working on that process right now. So a lot of new money, a lot of new positions, and we're all just trying to connect the pieces of the web. So more to come, but that's helpful to think about that. So we're early in the process. No funds have been allocated yet, but just wanted to let you guys know that the board can definitely provide recommendations and think about what positions or what are the needs in our community. Our public health nurse, Erin Coulard, has worked with the Southborough Public Health Nurse, and they did visit 2 recovery centers, one in Westboro, I believe one in Southborough, and talk to those recovery centers about what are their their clients' barriers to treatment and recovery, and sort of, you know, talking through how the town could possibly support them with that. So, okay.
Okay, what about this Be Well
Oh, like last
program that we
year.
have going on?
Yes, I know Teresa's not here. I think last time she volunteered to be there to help handing out. So again, that's why you have your Impact Melanoma, you know, sort of giveaways here and pamphlets and information. So with
What's your-
Northborough, we partnered with Impact Melanoma. There's new sunscreen dispensers installed at the parks. In the health department,
Right.
like many of the other departments in town, will be represented there, giving out free information and resources connecting residents to everything from mental health to hands-only CPR with the fire department. The police department will be there, so it's a great opportunity for residents, especially with young families. The inflatables and all those fun things are definitely a draw for them. Wegmans is donating food again. They were very generous, so there'll be healthy snacks. But again, it's a great way for, we're hoping for residents to connect socially and then connect with our various departments. Schools will be present. Library for talking about the summer programming there. So we'll be there with the health department. Erin's been a lot of freebies and
Yeah.
public health education. They'll have information on sun safety, tick identification. Don't know if they ended up finding swim safety. Michael has food safety information on summer safe barbecuing tips about, you know, cooking food to safe temperatures. So a lot of great information will be given out at that event.
My youngest went last year and has been looking forward to it all year, so they're very excited.
What are we doing for like advertising to get people there? What do you-
Yeah, so there's yard signs around town outside the schools. The flyer was handed out and should have gone out through the superintendent's newsletter and or, oh good, you saw it, yes. So that worked well last year. I think Ally and the rec department always has the pulse of the, you know, young families in
Young
town.
families.
So it sounds like a lot of people are talking about it. So we're anticipating, we were pretty maxed out last year with the parking, so we're trying to make sure there's additional parking at the back. But it seems to, the schools have been great partners, and so whatever we create, and we work with Mary Ellen, superintendent's office, and they distribute it. So.
Good.
Is this the second year?
Second year.
Second annual.
Yeah.
Is it Saturday, Sunday?
It's no, it's the last day of school. So the last day of school is always a half day. So it was picked to do it during the week. Also works well for all the town departments to be there. It's hard to do a weekend event and ask like
Right,
all
people
8,
to be-
10
yeah,
town
right.
departments to be present.
Yeah.
So yeah, it's on the last day of school, and it's always a half day. So that's, I think we had a good draw with families and grandparents bringing kids, and
That'll give all those 8th graders, instead of roaming around the
Yeah.
streets, we'll be, have somewhere to roam
Right.
to.
stop by the fun. We did a lot of sun safety thinking. I think the library with the people they're giving out free sunglasses is like a treat for the kids. You know, they have the prize wheel, but it was great. I think the library, I forget, they handed out over 500 summer booklets with all their activities. So
Yeah, they were very popular, and I got a lot of positive feedback from parents. My youngest is at Proctor, and it was such a great thing to do for the last day of school, something easy, make the last day of school special. Got to see all their friends still. I had tons of positive feedback last year.
Good.
So.
What day of the week?
Thursday.
Thursday. Last day of school. Good. Let's move on to some serious business. The regulations of the Northborough Board of Health restricting the sale and use of tobacco products. This is the final draft of what we've been working on. Some serious work here. Huh?
It is updated and ready to go. So Michael did circulate that. So it, just as a reminder, a public hearing was held at our last Board of Health meeting. That public hearing was closed. We didn't actually have anyone from any of our retailers appear at that meeting, but they were notified in advance. And the board did vote to approve it as written. So that final version is here for everyone to pass around and sign. You know, there'll be some next steps of making sure that that goes to the regulation. Oh, here's the signature page. So while not, there were 3 members, so there was a quorum and the vote was taken, but I don't think it's harmful for any of you that would like to sign, definitely anyone that voted, but we can pass that around for the signature. So that's sort of the last of formalities. It is effective July 1. Michael also posted the notice of the passing of the regulation in the Worcester Telegram and Gazette, so that will be posted and recorded. So if you haven't heard anything, I don't think Michael had any responses from the tobacco retailers, so it really doesn't change the products any of those retailers are selling currently. So
You were working on where smoking is prohibited, right?
So that's going to be a separate. So one thing is, I know you weren't at the last meeting. So our old regulation incorporated sort of the smoke-free workplace and the sale of tobacco regulation. It was a little clumsy. So most towns have it separated as 2 separate regulations. And so the plan is that there's a whole separate model regulation on that smoke-free workplace that Michael's working on now. So that would be passed as a separate regulation rather than trying to overlap the 2. So as this stands, the new regulation is just about restricting the sale of the tobacco products, and that would be separate if the board so chooses to adopt it, the other set of regulations. So there is a draft available through the Massachusetts Health Officers Association. Does have a model regulation on that
Right.
smoke-free workplace. So
we'll probably get that in August.
yeah, I would think Michael might even be circulating. He's in that rush of year end. I know he wanted to finish all his inspections. So the rest of June is very heavy on inspections, and we'll focus more on looking at that regulation and getting a draft to all of you in July.
So how can the board enforce the regulations, like if I see something going on?
It's really the same that we've always had. The enforcement hasn't changed very much. The structure is a little clearer here in local versus state fining structure, but ultimately it's the Board of Health and our inspectors that would enforce the regulation. So if you or a resident were to notice that something didn't look right and you were concerned it's not in accordance with our local regulation, you would report that to the Board of Health. We would do an investigation, a compliance check, and go from there.
Really holding the permit. The permit is the key to the authority, so to speak. Another one for the books. So official. Here we are.
Okay.
And send a note to Teresa. And Philippe's back Saturday, so they could send them.
But don't lose that one. Let's see. Any other business to come before the board? Moving right along. Oh, I'm sorry.
No. I think I'll take it home and read it. Like, you know. Sorry about that.
That's fine. Any other business to come before the board? Sir.
Good afternoon.
Good afternoon.
Do you mind coming up? Because I'm recording and I don't know. But you can sit right here with Angie and then.
Dress all nice.
It's all right.
Good evening.
Good evening.
Michael Creamer. I live at 1 Buck Hill Road here in Northborough. And I've noticed recently that the location, the Tredebi location at 345 West Main Street is now for lease for sale. So as being a direct abutter to that property behind them, I'm curious, based on the permitting, licensing, and knowing what that business does in environmental cleanup, and they had another application before the board in 2018 to expand their roles.
Yeah.
So now that that building is for sale, or that property is for sale, I'm assuming, I don't know for sure, that the permits that come along with the ownership of the land may transfer to a new owner. What are the board's plans to oversee, reduce the scope of that property so that a similar type of environmental waste type cleanup business does not go in there in the future.
Does any of that fall under the Conservation Committee?
I think it's planning department. I mean, we're involved with that, but I didn't know Tredebi was even in there now.
So I would think, I guess, so you're saying, and I don't know the status of that property, so if it's going to be a change in, like a new owner, there would be, that process would go through planning and or zoning, depending
Yeah.
if it was an allowed use or a special permit was needed. So I don't know if I can speak
Yeah.
to that. I haven't been around quite as long to know, any cleanup activities or anything like that.
Tredebi was in here, they wanted to establish a
Transfers.
transfer station where they set up the trucks, and then little or
Yeah.
smaller trucks would come and deliver hazardous everything, and they would load it up into 18-wheelers. When the 18-wheeler was to capacity, then they'd ship it out to wherever it was supposed to go across the country
Right.
for disposal and destruction, that kind of thing.
I think they have,
They pulled out.
correct. That's what I was reading.
Right? And everybody was like, yes, good.
But there still exists, and now there's a big for sale sign out front if you drive by. And I know that they did have trucks in there doing their normal business, even though it wasn't that specific business, but I
Right.
think they do have permits to do storage of some kind in a sealed truck or whatever I don't know the details, right?
Because they own that property.
I'm assuming so.
Debbie owned the property, and they bought it, and then they were trying to make it work. I believe it's been a while.
Right.
I believe that's how they were working it, and then they just said, there's just too much opposition, there's too much problems, and they pulled out. So, I don't know what's actually going on there.
So I completely understand that there's multiple aspects of anybody who would want to purchase that property, with the planning board, building permits, and throughout, maybe even zoning boards, right? But, I noticed this meeting first, so
Yeah.
here I am.
Well, it's good to bring it to our attention. So
Right.
the Board of Health, or at least the Health Department, we are copied on any permits from the Planning Board or Zoning Board. So given that there's a history and we don't have residents come talk to us all that much, so it's
Yeah.
good to hear that, to know what's important to you. So I can definitely flag it that if there is an application that comes across our desk, either through our department or another department, depending on the use, we can bring it to the board's attention, share a copy of that permit with you, and you can discuss it at a meeting. We typically are given enough time that there's a Board of Health meeting prior to any final permitting board taking action. So we can
Yeah.
flag that for sure, and bring it to all of your attention.
And
So,
had-
and feel free, if you do hear of an application or an owner, you can call the Board of Health, and happy to, within our jurisdiction, take a look at it and see, regarding the cleanup, if there's the property, that follows the chain of whoever owns it. So even if another owner comes on board, they in purchasing that property would take responsibility. So that cleanup will always exist, so
Sure.
that there's a due diligence process for that change of ownership. So
I guess my question wasn't really about the cleanup of the property, but more about the work that company does and the permits that they have available to them to do their business. Would those transfer to a new company, and is that in the grand scheme plan of, the health department, the planning board, the zoning board, and something that we want in town? Because
I know there were concerns with the cleanup of local hospitals about radioactive things, so that's why.
The cadmium,
Yeah.
right?
So,
Cadmium?
I don't know.
Cadmium?
we don't
I
currently
know
have
that,
any
but
permits
yeah,
at this
but
point
is
for
what
that
they
property.
were proposing when
Okay.
they wanted
Oh.
to come and yeah.
Okay.
is it possible to ask the board to do a little homework to see what licenses that Tredebi location currently had, or currently
It's
has?
certainly possible, and we're more than willing to go through, the town departments, but I think planning board's really the one. I think this falls on the planning board.
Yeah, we don't have any permits for them. So we permit, under the Board of Health, we permit
Yeah.
various things, septic installers, tight tank review, what's on site. So For that property, I'm not aware that we would have any permitting threshold. It would fall to those other departments, but a lot of times permits are non-transferable. It could be a state permit or license, regarding that. So we can look into it, and I could check with our town planner, who's very in the loop with properties for sale, and see where things are. And if you want to either leave your contact information with Angie here, or myself, or call us, next week or later this week, I'm happy to let you know what I find.
If I could leave my contact information with you, I'd
actually,
appreciate
do you
it.
mind signing in on that too?
Here?
Yep.
Yep. Will do. Oops.
There's some big files about the Tridebi. I
Yeah,
heard
yeah.
it.
Revisit
It wasn't
that
just this board that was
because
involved with it, it was like a town, all the departments were involved, and because it was,
there were
they
concerns for
weren't-
traffic. Because
the only thing they could really do, if I recall, was there was park their trucks there after they split.
right, but it would be a lot of back and forth and lot of large trucks.
No, when their plan fell apart.
Oh, when
The only thing that they were allowed to do was
Yes,
use it like
yes,
a,
yes.
a parking lot, basically, for their own gains.
How many years
Yeah, that was
ago?
all we used to talk about.
2018, it was a
Okay.
biggie.
Meetings.
It was a
Yeah,
biggie.
they were very busy,
Yeah.
or, doing their, whatever it is they were doing.
Okay.
And now they've stopped, which is, nice on the ears and nice to know
Yeah.
that things aren't moving around. But you never know what could be.
So we're not pushing the buck off, just,
Yeah. All right, I appreciate
for
the follow-up.
what it concerns the Board of Health is, it's almost secondary, aside from the overall health of the community, with regards to what's planned there, or what can go there, or, that's, I believe, the planning board and the zoning board.
Yep. We'll find out.
Yep,
All right, thank you.
okay?
All right. Thanks for coming by.
Thank you.
Enjoy the solitude while you have it.
Thank you very much.
All right.
Yeah, they would have to have special permits, like we would have to give special permission for certain waste
We're gonna have to clean
products,
that
and it
property
was
up.
like a huge,
Oh, it was
it
terrible.
was
They were coming from everywhere, these little box trucks.
carrying who knows what
And
kind
it's
of
just like,
waste,
oh
and
my
every
God.
waste had a
Yeah.
code, and we, approve all these scary.
Yeah, we
sounding-
had all these schedules of what they were loading in different, it was terrible. Thank God, they just and then all of a sudden they just withdrew their request for a permit.
They've
I
done a
can't
nice
remember why.
presentation. They
Yeah.
had,
Yeah, they had people coming up, remember?
Well groomed.
Well,
you're well groomed, yeah, business.
almost like Wegmans, but for like the total opposite. Wegmans is always seems to be prepared and ready to go. They had a lot of money involved with that. They bought that property and then just got stuck with it. That's what happened.
So you can convert it to a dog park or something.
So it's
Sorry,
going to have to
moving
clean
ahead.
that
They
up.
already have one.
That's right, we have one.
Process. Yep.
Where? Down what?
Did you miss town meeting?
I might have been snoozing if that.
It's okay. It's off of
No.
Hudson Street, off of Hudson. I think.
Oh, really?
It's closer to Route 20
Boundary Street?
Boundary. Thank you.
okay.
Oh, yeah.
That way.
I live here in town. You think I would know?
Boundaries.
Allen, close to Allen.
Boundaries where it goes by the treatment
Past
plant in Marlboro, right?
Yeah, it's like towards the Marlboro line. Yeah. All right.
Oh, yeah, I remember now. Okay, we can't approach the minutes. And we'll establish a tentative future meeting date, August 8th. Good. Anything else?
Yeah, on that August 8th, I was proposing, I believe I'm away that week of July. If a meeting comes up in a need that we have septic permit or something that would need your approval, we'd look to have a July meeting. But given we're sort of done with all the grants and the deadlines, I would be open to skipping that. And I know it's summer, it's busy, and we'd look for that August 8th. So if you want to save, does it look like August 8th works for most with vacations?
Tuesday.
The same Tuesday at 6 in
Yeah,
person?
I think so.
Should work.
Should be okay.
Okay, so we'll keep that on the books and
Good.
from there.
Good. I move that we adjourn this meeting.
I second.
All those in favor? Aye.
Aye.
It's unanimous. All right.
Okay, I'll take some.
Very, very informative
Eat
meeting.
some. Thank
Yes.
you.